Frederick B. Stahlman is an individual who has the ability to guide his patients through physical, emotional, or spiritual challenges with grace and ease. With his extensive background in manual therapies as well as craniosacral therapy, he is able to bridge traditional and complementary approaches to assist his patients in understanding of the issues at hand and the belief systems that maintain them. Together, they open new doorways of freedom. Fred's background includes extensive study with most of the masters in manual therapy, as well as in-depth study in the advanced realm of craniosacral therapy, lymphatic drainage, visceral manipulation, somatoemotional release, and awareness release technique. So I'm going to hand it over, and I will also say that Fred's also a Big Ten guy from Northwestern, just like myself. So I'm going to hand it right over here, Fred, and I think I had you muted, but take it away. And thanks for omitting those. I saw that. Thanks, Fred.
Thank you. Wow. I wonder who is that guy you're talking about. So anyway, I'm really happy to be here with you to share a little bit about the essence of craniosacral therapy and how it might pertain to the PTSD client. Whether you are a PTSD client or you treat them, hopefully you'll get some information from this hour. And I think, first of all, I'd like to just, for those of you who don't know anything about craniosacral therapy, we'll kind of touch a little bit about what it is. For those of you who know a lot about it, well, then hopefully you won't be too bored as we move forward into how this work, how I interpret how this work is effective with craniosacral therapy and PTSD patients. So let me get to my screen share. This is always my biggest technical challenge I have. I'm a dinosaur in this industry. And I've been around it a long time. So my background, as Justin said, is in manual therapy. My background is physical therapy. And I got introduced early on with Dorothy Voss, the founder of the PNF, or proprioceptive neuromuscular facilitation movement in Northwestern, and had the advantage then coming out to study with all the major educators in the PT world. They were teaching manual therapy, you know, all of Stanley Paris's work and all of Freddie Kaltenborn's work, and Robin McKenzie, Mariano Roccabato, Cliff Fowler, Barrett Dorco. I had some amazing mentors. In running out of people to study with, I got introduced to John Upledger, and my journey ended with John Upledger. I finally found what I was looking for in the realm of craniosacral therapy. So let me see if I can shrink this a little bit so you can see some of the slide. So I'd like to do is just kind of do a quick overview of craniosacral therapy. The craniosacral system is a universal system that is composed of tissues and fluids at the core of the human body. It's the breath of life, basically. It's an important function of the CSS is to produce the production, circulation, and reabsorption of cerebral spinal fluid. And it maintains the physiological environment in which the brain and the nervous system develop, live, and function. So critical to have a healthy craniosacral system. And it tends to work in conjunction with all the other rhythms and systems of the body. You know, we have the nervous system. We certainly have the lymphatic system. We have the cardiovascular system. You know, everything has a rhythm. We have the circadian rhythm, and all these things kind of work together in harmony, and have to work in harmony if the body's going to be functionally okay. And it's when it's not is when we have a problem. The whole cranial movement started by this gentleman in the 1920s, William Garner Sutherland, an osteopathic physician who discovered through trial and error observation that basically the cranial bones are mobile throughout life. And obviously, he changed the whole direction of the osteopathic movement back in the 20s and 30s. His training came from A.T. Still, the founder of osteopathy. And this other gentleman, Emanuel Swedenborg, who was a Renaissance scientist in Europe studying brain and soul connections back in the late 1600s and early 1700s. So what Dr. Sutherland did was discover this cranial mechanism. He named it the craniorhythmic impulse, the primary respiratory impulse. But what he did was he mapped out the entire rhythm cycle of all the cranial bones, with the spheno-basilar joint being the primary lesion site. Develop concepts of how to modulate, how to maneuver and enhance the cranial rhythm. And so then along comes another player in this journey, and that's my mentor, Dr. John Upledger, a brilliant practitioner, brilliant thinker. I've had the blessing of having him be my mentor for all the cranial curriculum classes that I have taken, and unfortunately passed away in 2012. But those of us that are still around are trying to maintain the legacy. And that's why I love the opportunity to speak to you about craniosacral therapy. I teach level 1 and level 2 of the craniosacral therapy curriculum. And it is probably the most profound technique or treatment approach I've ever encountered. And what makes craniosacral therapy so fascinating is that it's a system that is a process-oriented system. It's not a techniques-based process. We treat the whole body, mind, body, spirit, and we use it from the original foundational principles that AT still developed back in the 1800s. The body is a unified whole, and structure and function are interrelated. And the body has this inherent inner wisdom or inner guidance, inner wisdom, inner physician, whatever you want to call that. This is a guiding principle in the healing journey for our clients. So we take these principles of application of craniosacral therapy, which is based on very light touch work, looking at strain patterns in the body, in the fascia, in the intracranial and dural membranes that influence and influence positively or negatively the expression of the craniosacral rhythm. And when we're looking at the craniosacral rhythm, we're always looking for patterns. We're looking for symmetry of motion. It should be the same left side, the right side of the body, front to back, head to toe. It should have a nice strong quality to it if it's functioning on all cylinders, so to speak. It should have a nice range of motion or amplitude, and the normal rate is somewhere around 6 times a minute. So with that in mind, we use these principles of palpation, which Dr. Upledger very adroitly taught us how to use to evaluate our clients and to apply specific techniques to facilitate the body's self-corrective mechanism. Now, the really interesting thing about craniosacral therapy is the whole paradigm is that the therapist is a facilitator or a guide to the work. This is a patient-directed treatment. With that, we're working with the patient's inner wisdom and inner guidance to teach us and show us where to work and how to work. So this type of work is so different than anything else I've ever encountered, because every other technique I have in my tool bag is an outside-in treatment approach, and it's therapist-directed. The patients are coming to us for guidance on our expertise of how we apply various types of body works that we might choose. Well, the craniosacral therapy is a totally different package where, number one, the therapist is a facilitator or a guide, not in charge of the treatment. And we learn to work with the patient's inner wisdom and our inner wisdom to facilitate the healing journey. The other thing that we really focus on is that in the craniosacral world, we don't treat symptoms. We don't treat disorders. We treat people with symptoms and disorders. And so that's, as we're looking at this particular clientele base, the post-traumatic stress disorder client, obviously we're treating a diagnosis, but in reality, we're treating the patient with PTSD. And it comes with a variety of different symptom presentations, as you know. If you suffer from PTSD, you know that very better than anybody. And those of us that work in this field also understand it. And I think this has been a great, craniosacral has had a major impact on helping to unlock the tension patterns and unlock the trauma patterns that patients tend to hold on to. And then Dr. Upledger has always said from the very get-go that the body always holds on to trauma. And you can talk yourself through, you know, there's a place for counseling. Absolutely, there's a place for counseling. But unless you have a somatic impact to release the trauma that's held in the body tissues, then you're dealing with a mental body construct. And so often that works very well, but there's so many times when patients will come to a craniosacral practitioner and they hit into this emotional realm with their work, and they get a little frustrated because they thought they had dealt with those issues, and they had from a perspective of counseling and strategy, but they haven't always dealt with the trauma that's locked in the tissue that will tend to resurrect that emotional trauma package in a heartbeat if the wrongs or the situation is so inclined to ignite it again. It's a tissue remembers. And we know that Bessel van der Kolk's been hot on this circuit with his book, The Body Keeps Score. And he's there showing you as well. Dr. Upledger was saying this in the early 70s and 80s. Bessel van der Kolk saying it in the 2000s. So, you know, the body holds on to trauma. And so the craniosacral work, along with other disciplines, you know, craniosacral is not the end all to be all, but for me, it is the best tool I've ever encountered to rebalance the sympathetic autonomic nervous system, facilitate the parasympathetic nervous system into activity, and hence the healing process. So if we look at PTSD, lots of different definitions, but the one commonly used is a mental health condition that's triggered by a terrifying event, either experiencing it or witnessing it. And sometimes it's one event, as you know, sometimes it's a series of events. People living in a traumatic family unit, sometimes they can't escape. It's not just a one and done trauma pattern. Or veterans that have been in unbelievable traumatic situations through combat, or people in accidents or watching accidents. You know, you never quite know the impact it has until it has its impact on you. And some of the major symptoms that we see with this are intrusive memories. Out of the blue, you hear a sound, firecrackers going off for a lot of people that are triggered by the trauma pattern of explosions or gunfire. Avoidance, we try to avoid trauma patterns. We try to become reclusive at sometimes. Negative changes in thinking and mood. With PTSD, often perhaps there is traumatic brain injury with that. Sometimes there's not. Sometimes it's just the emotional shock overload of having an explosion near you or some type of traumatic event that just rocks your very core. Other times there's traumatic events personally, car accidents, head trauma, blows to the head, severe concussions, that kind of a process. So it changes personality, it changes attitudes in how we see the world, unfortunately, usually in a negative vein. And it changes the physical and emotional reactions to things. All right, so those of us who know PTSD, treat PTSD or have it, realize that, you know, the personality is pretty volatile, right? So let me see if I can move this. All right. So how does craniosacral therapy impact the PTSD client? Well, from the experiences I've had personally, as well as my colleagues who have worked in this field for a long time, and the research that's out there, and the intensive programs that the Upledger Institute has been a part of, it seems to have an extremely positive influence on balancing the autonomic nervous system. For the PTSD client, or the trauma-induced client, as we well know, the sympathetic system is our fight or flight system. This is our defensive posturing, fight, flight, or freeze, involving, you know, working with the sympathetic nervous system as well as the dorsal vagal part of the vagal nervous system. So that creates this fight, flight, or freeze response, and it makes you on edge, highly irritable. Your sympathetic system is kind of on fire. And when the sympathetic system is on fire, the parasympathetic is not functioning as well. So you're on edge, you're kind of hypervigilant all the time. You don't sleep well. It has a negative impact on your overall health and vitality, right? And it also, the craniosacral work helps to diffuse the emotional impact of the traumatic event. The whole essence of craniosacral therapy is to as it moves into the SomatoEmotional Release world, and we'll talk a little bit about that in just a minute, but it's so important in our work to know the difference between acknowledging a trauma event and becoming identified with it or immersing into it. When you identify with it or immersing into it, it controls your behavior, controls your thinking. It's the Monsters, Inc. But if you can guide your client or your patient successfully to touching the traumatic event, not to throw gas on the fire, but certainly to touch it, to make it real, to taste it, so to speak, but then bring in this inner wisdom, inner guidance, inner physician to ask for clarity and guidance of what you need to know for your highest and greatest good to move through this process. So that's the art of craniosacral and the SER process. It helps to restore a sense of self and purpose, well-being. You know, those of us that have treated PTSD, the clients we know, or if we are PTSD clients, there's a sense of desperation sometimes. We've kind of given up hope and purpose that we'll never be able to escape this. And we develop our strategies. Sometimes we start imbibing in excessive drugs and alcohol using, other type of adaptive coping skills that just don't work real well long-term. So hopefully the craniosacral work can help diffuse that and restore a sense of self and purpose. And it restores hope. I think that's one of the things we've seen in some of the reports of clients that have received craniosacral therapy for PTSD or trauma patients in general, is that it has given them a sense of restored hope, that there is something out there besides living in a sympathetically biased world. So let's take a peek at this whole stress response, if we can. This is kind of a standard, and the importance of this is it kind of guides us through this whole process of the stress response. Now, this is a standard neurophysiological stress response that you can find in any medical physiology textbook. Okay? So let me see if I can get rid of this just real quickly. So we have a threat, and we've all experienced this at some point in your life. You have the sympathetic nervous system, which is your fight or flight system. You have your parasympathetic, which is your rest and digest, health and vitality. In a normal situation in our lives, we have a healthy balance between these two systems. These are the autonomic nervous system components. And with that, all of that, those help regulate and guide the central nervous system and a lot of our involuntary responses. So we have a threat, and perhaps that threat creates a fear response in our body. Normal, it's understandable. And that fear leads to a thought, and that usually happens from the frontal lobe into the hypothalamus. So that thought then is activated as a biochemical response heading to the pituitary gland, which sits just behind the eyes in the sphenobasilar joint, or in the sphenoid in the sella turcica. So the pituitary, our master endocrine gland, is activated by this thought process coming out of the frontal lobe into the hypothalamus to the pituitary, which then sends out messages. It increases adrenaline and cortisol production, which activates the adrenal glands. And what that does is kicks us into a hardwired increasing sympathetic autonomic nervous system activity level, the SANS response. And that is all about action. So when you're in fight or flight, this is protection or action. You're either moving to something, moving away from it, or the other option is to freeze, which is a normal biological response in some species, and certainly in the human species as well. We have an increased blood supply going to skeletal muscle. And you can understand why that has to be, because we need blood supply to the skeletal muscles to lift cars off of people, leap tall buildings in a single bound. We have increased blood supply to heart and lungs. We need to be able to breathe faster. Heart rate increases, blood supply increases, and increasing blood to the hindbrain, which is your reptilian brain, reticular activating system, and the part of our brain that's geared and hardwired for action. You don't need to be thinking about a lot of things when you're trying to survive or fight for your life, whatever the case may be. It's action mode, right? No thinking. It's hindbrain, also known as reptilian brain, survival brain, and very much connected to this whole emergency response through the reticular activating system. So as this is firing, the parasympathetic nervous system is turning down because you can't do both. You don't have to worry about cell growth or organ growth or digestion or any of those visceral functions whenever you're surviving or fighting for survival. So the body has this defense mechanism where it turns down the parasympathetic activity, decreases growth, decreases blood supply to organs, decreases immune function, increases disease potential over time. If your immune system is down long enough, you're much more subjected to viruses and bacteria and disease in general. Your vitality, your immune system is compromised. Decreasing blood flow to the forebrain. That means you have fuzzy thinking, can't communicate, can't concentrate very well. Foggy brain, right? Decreased ability to think over a time period. And then it leads to decreasing mental clarity and increasing a sense of confusion. And it over time decreases IQ for people that like to test IQ. So this is a normal stress response. What does craniosacral therapy have to do with this is that, from my experience, light touch, we use a touch that's about 5 grams. And some of the most recent research on fascia says that fascia isn't just layers of tissue, it's constitutive tissue. It surrounds every body part, every system, every organ, every muscle fiber, but not just surrounding it, it penetrates it. It becomes part of the cellular matrix. So it's in every cell. It connects every cell together, and it has a direct link to the nervous system, and in particular, the brain. So as soon as you're touching with light touch, there's no defense for that. So if I push hard on someone, I use a deep, heavy pressure, a manual therapy technique, the body can resist that up to a certain point, and whoever is the strongest wins. In the craniosacral world, there's no defense for 5 grams. That's a weight of a nickel. And as soon as you understand that, as soon as you touch them with that light therapeutic intention, you're connecting into the fascia, and that fascia is immediately taking you to limbic system. And the limbic system is our midbrain, and this is where the amygdala and hippocampus have stored a lot of tissue memory. This is where all the sounds and smells and language and proprioception and taste, all those messages go immediately from the bodies into the limbic system, stored, waiting to be processed. And when stimulation comes in, it activates the sympathetic nervous system by way of the reticular activating system. That triggers the amygdala and the hippocampus, and it fires up this sympathetic response, learned behavior patterns. What the craniosacral does, from my experience, is it turns down the firing potential of the sympathetic nervous system. Simply, light touch is not perceived as threatening in most cases. So as you touch gently in non-threatening places with a non-threatening therapeutic touch, with a sense of love and kindness, with an intention to help the patient facilitate change and self-correction, the body takes that and it seems to turn down the sympathetic nervous system, and that automatically, in spite of us sometimes, activates the parasympathetic nervous system, and we get change. And if you can just see, if you reverse the firing potential, so sympathetic turns down, the parasympathetic comes back on, what do you get? Increasing blood supply to organs, increasing blood supply to your pituitary that brings about healthy change in body, increasing immune function, increasing your resistance to disease, increasing blood supply to your forebrain, your thinking clears. So you reclaim your sense of essence if you can turn down that sympathetic nervous system let the body activate its parasympathetic system, and you get the rest and digest and the healing process. This is part one of craniosacral therapy. Now, part two is dealing with this. Some of this work comes out of Bruce Lipton's work. So if you've read Bruce Lipton's Biology of Belief, as you know, he came out in the early part of the 2000s, directly challenging the gospel of genetic determination, and looking at this whole process of epigenetics, and that the body's interpretation of turning genes on and turning them off, helping genes express, is the perception of your reality. As you see the world, as you perceive the world, you will manifest that behavior pattern. And this is what we saw in all the New Age books that came out in the early 2000s. The law of attraction, the attractor factor, Think and Grow Rich came out in 1930. Florence Scovel Shinn, The Game of Life and How to Play It. They all say the same thing. What you think about is what you create. So this cycle is the cycle of life. So perhaps it starts with thoughts, and you have a thought. And as you know, if you repeat that thought enough times, it evokes an action. It creates an action potential, and you do something about that thought. And if you do that, repeat that action enough times, it becomes a habit. Think about when you get into your car to drive. Do you have to think about driving your car? Unless if you're new driving, yes. But for the most of us, those who have been around driving since Fred Flintstone was pushing the pedals of his rock car, then basically you do it automatically. You don't have to think about it. It's a habit. You get in, you close the door, you put your seatbelt on, you turn the ignition, and then you go. All right. It's a habit. You don't have to think about it. But that habit then, if that's repeated, becomes a belief system. And then now you have a belief system that funnels this cycle. So where it started maybe with a thought is now the belief system has taken over, and it creates the thoughts, the actions, the habits, the beliefs. So if you see the world through the filter of fear, because you've been involved in severe trauma, you've witnessed it, you've seen it, you've experienced it, whatever the case may be, this is now the belief system that drives this cycle. And how this impacts us in the craniosacral world or in the life of reality is this little slide. Now, in the red, that simply is the sympathetic response. We had the lines coming down before, the nice little typed written statements of sympathetic response. Now it's in red, right? The green represents the parasympathetic response, all right? In this upper left-hand corner, as you're looking at this slide, is that little cycle we had: thought, action, habit, belief. And if you continue this cycle, then what happens is the belief drives the thought. The thought is driven by the perception that my world is a scary place. That is the driving force that now is the trigger. The thought originally was real. The threat was real. You had a response. The nervous system was programmed. Amygdala, hippocampus, limbic system, reticular activating system. All that now becomes kind of hardwired in response to a stress pattern. And it doesn't even have to be the same stress. It can be a different stress pattern. All right. So it may have been a traumatic event in a war zone, now activated by firecrackers or a car backfiring. Or if you've been in a severe car accident, you hear tires screeching down the street, and you're immediately back in your process, because all of this is now acted in a split second or a microsecond. So now what drives your behavior is the perception. So where our work comes in handy is the craniosacral therapy. I think, from my perspective, knowing the tools I have in my experience, is the best tool I've ever encountered to turn sympathetic system down and allow the body's self-healing mechanism of the parasympathetic system to kick in. Then the craniosacral work has to move forward into the somatoemotional release world to deal with the belief system. And this is where we go in our craniosacral world. Craniosacral, craniosacral plus SCR, this is now our PTSD client. This is the cycle that drives our PDS individual, our head trauma patient. So this combination, I think, is the essence of why craniosacral therapy is so profoundly effective for head traumas, PTSD clients. And so let's just take a quick look at, for some of you, this might be a foreign concept. Maybe it isn't. I think a lot of the people that are plugged into our meeting tonight are craniosacral practitioners. Some are instructors, some are certified therapists, and some maybe not. So the SCR process was a process that Dr. Upledger discovered by accident, as most things usually are. So the SCR stands for SomatoEmotional Release. Is a therapeutic process designed to help the body dissipate the residual effects of past injuries and negative experiences. We don't tend to hold on nearly as tightly to positive influencing thoughts as we do the negative trauma patterns, right? So where did it come from? It came from, as I said, a serendipity discovery. Nothing's by accident. Everything is by purpose. But Dr. John Upledger and his research team, Dr. Carney and some other people, noticed this when they were working with patients. Underneath the physical trauma was the emotional component. And once they worked that out, the physical trauma was much easier to be dissipated and have the patient self-correct. And it's based on this concept that the whole body, every cell, every tissue, every organ system has an independent but integrated consciousness. I think Dr. Upledger was very clear that every cell is a conscious entity. And so what we're working with is why the body works as a community. The cells talk to each other. And so, and we're releasing trauma, we've got to release the trauma pattern held in the tissue, right? And it's a model based on the body's wisdom, utilizing what Dr. Upledger would call the significance detector. And this is a situation whenever you're dealing with a significant event where the client or the patient is actually tapping into it, not just the story, but the event itself, the body's cranial rhythm will stop cold, or it'll stop instantaneously to a level below threshold. So it's like the cranial rhythm stops to say, this is an important place, stay here. Ask the questions if you're asking questions, or hold the body in this position until the cranial rhythm comes back on. Get a tissue release. It helps to unlock the emotional trauma that sits underneath the physical trauma. Right. So how does it work? Well, who knows? How does anything work? We still don't know how aspirin works. So it's a process that occurs when the inner wisdom of the client, that inner physician, inner wisdom, inner guidance, intuitive nature, whatever word you want to use, feels safe. It's like you've created an environment where it's okay to be vulnerable. And for a lot of our PTSD clients, that's a really difficult situation to find yourself in. Vulnerability was dangerous, life-threatening, So not always an easy place to get to. But the inner wisdom knows you're in the right place, the right time to release this trauma pattern. It requires great sensitivity on the part of the therapist, as well as the ability of the therapist to hold a very sacred space. Suzanne Scurlock would call this a therapeutic presence, where the environment is so safe that the client is able to be vulnerable and do their processing work. And it often requires an exploration of the belief system that created the problem in the first place and is holding on to the emotional trauma. So that's the connection between the body holding and the emotional holding in the limbic system. And that connection by way of the autonomic nervous system is the hook, all right? That's what we want to be working on. And we've mentioned this concept of the reticular activating system a few times. So what is this thing, right? It's a very dense network of neurons within the brainstem. The brainstem sometimes is called the R complex. It's also sometimes called the reptilian brain in the triune brain model, also called survival brain. This is your fight or flight system on steroids, all right? This is what wakes you up in the middle of the night when you hear a noise in your house that you shouldn't hear, whether it's your child crying from a nightmare 2 or 3 bedrooms away, and you're up like a start. This is your hyper-vigilant, hyper-alert, and it activates especially under stress and when you're sleeping, involving brainstem, pons, and medulla. And it activates this reticular alarm system to enhance hypervigilance. This center receives sensory data, millions and millions, if not billions of sensory messages a day, prioritizes it, sends it to the midbrain, the limbic system, amygdala, hippocampus, other parts for storage and categorizing. Wherever it's stored, who knows? They're still trying to dig out all these memory places, all right? And if it's appropriate, it relays it to the cerebral cortex for action and decisions. But it deals with our sensory data, visual light, taste, smell, proprioception, all that. So, and it's also intimately related to the nervous system, the cranial nerves in particular. Increasing stimulation increases arousal, contains centers for control of blood pressure, heart rate, respiratory rate. Whenever we're stressed or triggered, these things go off the Richter scale sometimes. Intimate connection to the trigeminal nerve. Clenching, grinding, fighting, arguing, all this is a trigeminal nerve response. Optic nerve sometimes. Optic migraines can come with this. Facial nerve, glossopharyngeal, enteric nervous system, which is the gut. And more research is showing the relationship between the gut and the enteric nervous system and all types of neurological diseases that we used to think were brain traumas or neurologic brain diseases actually can be coming from leaky gut syndrome. So fascinating, the research that's going on out there. So what I have is just a couple a few studies. There aren't many out there, but there are a lot if you go digging. Now, the Upledger Institute, under Dr. Upledger's tutelage, was very active in wanting to treat veterans as well as professional athletes with concussion injuries. But in particular, PTSD and trauma was a very important area for him to want to invite us as craniosacral practitioners to move into. They did this one study at the Upledger Institute. And they did 24 veterans officially diagnosed with PTSD by the Veterans Administration. It wasn't done by the Upledger Institute. Right? This is a pretty extensive study, hasn't been quite duplicated in this fashion since. Right? 4 2-week sessions utilizing craniosacral therapy, SomatoEmotional Release, and other allied techniques, which could include visceral manipulation, maybe chiropractic, maybe massage, but they used a variety of techniques. But the primary tool was SCR and craniosacral therapy. Right? 22 of the 24 vets completed the program with significant improvement in all the parameters that were tested. They were tested before the program started and after, and at a 5-month follow-up. And the results were pretty significant. If you go to the Upledger website, you can probably find this research project, and it has all the graphs that show all the significant changes. But in general, the summary is the parameters showed improvement in the personal assessment and testing, physical function, social function, ability to participate in social roles and activities, anxiety, depression diminished, fatigue diminished, sleep disturbances were significantly changed, and pain interference in their life was markedly reduced. Right? And then what they did is they did another program was done for a week, a 5-day intensive program with 6 veterans using craniosacral therapy and SCR. They were receiving treatments 4.5 to 5 hours a day, a couple hours in the morning, a couple hours in the afternoon for a week. And what they showed at the post-clinic summary of evaluation was a 20-point drop in their PTSD parameters, all right, which is twice the normal rate that they had expected. So this immersion program, this is what the 5-day program. 4 of the 6 patients were reevaluated after 5 months. 2 of them didn't even be classified as PTSD patients any longer. All right. So there was a significant clinical statistical improvement in depression, insomnia in 3 out of 4 of the patients, quality of life and social activities, anxiety, depression, fatigue, pain interference and life activities all improved, a sense of well-being, and certainly a reduction in pain scores. Pretty impressive when you think of 5 days of treatment and what the impact this had over a 5-month period carryover. Another interesting study, small numbers, but this was done by a naturopathic physician named Lisa Chavez. She tested 38 Tibetan ex-political prisoners in exile who were tortured and experienced severe trauma and treated with CST. All were given medically accepted trauma questionnaires before and after CST, and the group was divided into 2 groups. One group of half of them got craniosacral and half did not. And the significant changes seen in the craniosacral therapy group was markedly different in anxiety, somatic complaints, as opposed compared to those that didn't receive craniosacral therapy. And then there was a study, another small one, but poignant, where they did a qualitative study in Norway on outpatients, 8 participants with severe body symptoms and with PTSD. And they were evaluated by psychologists in this clinic. And so then that group got craniosacral therapy, and there was a significant improvement in ability to transform negative thoughts, negative behaviors, and develop positive attitudes. And then these are a couple, not necessarily PTSD, but very interesting studies on NFL players, just showing significant change. Another intensive program at the Upledger Institute, as well as other places around the world, significant change in mood, depression, physical function, and reflexes. Right? So, I know the Upledger Institute's been very active in one particular case with a group of retired professional football players led by Ricky Williams, with tremendous changes in their overall results of the 1 week of treatment. Some other pertinent studies. Dr. Upledger and Tad Wanveer posted this in Massage Today, just helping the brain drain, how CST aids in ADAD and ADHD. Obviously, Bessel van der Kolk and Body Keeps the Score. And then the concussion craniosacral therapy, visceral manipulation classes. There are some great classes out there that Upledger has developed. Marianne Cisco did a phenomenal new concussion class, which fits into this paradigm, right? And this is just a very nice case report. Sarah von Kratz did one, but it was, the more people do these, it just shows you the results are out there. Significant change in presentation of this one particular client. Melinda Rowland did a phenomenal article in Massage Magazine on craniosacral therapy to address post-concussion syndrome, which is very prevalent in many of our PTSD patients. So that's kind of my story. I think, as a quick wrap up, I think craniosacral therapy is a phenomenal modality. It's a philosophy of treatment that embodies the original osteopathic principles of the body is a unified whole. Structure and function are interrelated. The body knows how to fix itself if we can tap into that inner wisdom and inner guidance. And using light touch, therapeutically driven, following the Upledger protocols, we have found significant change in turning down that sympathetic nervous system, allowing the parasympathetic to kick in. And then as our clients are dealing with that, we can help guide them, if they're so inclined, to tap into the emotional trauma package that is in the cell tissue in the body, using our SCR skills to guide and direct the client to look at that belief system and be able to unplug the emotional component to that. Doesn't change the memory, but it changes the emotional hook. And that's our goal for craniosacral therapy with any client, but in particularly those that struggle with this very difficult PTSD diagnosis. So thank you very much for your attention, and I hope there was something in there that was informative and valuable to you.